Hello and welcome back to the East Lake Pet Talk podcast. I'm veterinarian Dr. Karen Fling, and my co-host Dr. McCauley is away at the AVMA this week, but he'll be back with more news next week. But what's new at East Lake is the rescue of a precious little Chihuahua that we're affectionately calling Addie. Addie was brought in by a Good Samaritan police officer with the Dallas Police Department. And this little angel came to us from a huge meth lab that they raided and shut down right here in Dallas. And that's certainly great news for little Addie and great news for our community. And honestly, there's probably not a week that doesn't go by that we are touched by the kindness and support of the people of the Dallas Police Department. Just each week there's either some show of support or pet rescue involving them, and we're really grateful to have them supporting our community. In other East Lake news, we did have just another emergency splenectomy surgery a couple of nights ago that Dr. Pennington and Dr. McCauley were involved in. And as is common in these cases, this poor dog came in weak, collapsed, and bleeding internally from the tumor that was present on the spleen. And when this happens, the treatment is an emergency removal of the entire spleen to stop the bleeding and prevent the death of the pet. And in these cases, there is typically no warning that these tumors exist. What we do know is that certain breeds are more predisposed to these tumors, such as German Shepherd dogs and retrievers. We've also seen several cases occurring in Schnauzers and in mixed breed dogs. Additionally, cats can also have tumors of the spleen, and the age that we typically see these problems occur is in the age above 5 years old. But splenic tumors have actually been seen as early as 4 months of age in some pets. The means of diagnosis of these tumors is done through x-rays or by ultrasound, which is why East Lake has started a reduced cost sonogram screening clinic one Saturday a month. We hope that in offering this service that we will help more dogs and cats to avoid emergency situations, save cost for pet owners, and provide peace of mind for pet owners, as well as providing a service during the weekend where the average person won't need to miss time off from work. For more information or to set an appointment, call 214-342-3100. And besides sonograms used to prevent emergencies, one of the best means of preventing disease is by focusing on dental health for our pets. 70 to 80% of pets have some form of oral disease by the age of 3. And that's why we're so excited to have Dr. Stacie Smith with Virbac Animal Health here today to teach us more about how to prevent dental disease for our pets. Well, Stacie, thank you so much for joining us here in the studio, and it's really exciting to get to meet with you because, as you know, all of the doctors on our doctor team are so passionate about preventative health care and about dentistry. And tell everybody a little bit about your background and just what it is you do for Virbac.
Okay. My name is Stacie Smith. I am a technical services veterinarian for Virbac Animal Health. And what I do in my job is mainly educate our sales staff, but also we go into clinics and educate clinic staff as well on home dental care and other products that we have.
Right.
But mainly our focus today is to talk about dental care that you guys can do at home.
Right, and I think that's so important because by doing a lot of these things and really being empowered to be in charge of your pet's dental health, you can extend the time in between professional dental cleanings and avoid anesthesias that might
the goal is
otherwise be necessary.
Right, to prolong that time between dental cleanings that you'd have to have done at the clinic.
That's great, and dental disease is painful, so doing a lot of these things to prevent oral disease I think is so important, and it really does protect a pet's overall health.
It does.
So how do you like to approach this from the get-go? What are some of the best recommendations you have?
We have a tagline that we like to say, it's good to chew, better to rinse, best to brush. But that being said, truly the best home dental care program that you can do and institute is one that you're going to do. So you may think that brushing is best, but if you're not going to go home and brush, then that's not the best choice to make.
Right, and mentioning that makes me think of a funny story with a lady who visits the practice. She had her toothbrush kit there, and she'd read all the literature, and it said, when you're relaxed and stress-free and have plenty of time, begin your toothbrushing regimen. And she said, I'm still waiting months later. That time has not come.
Exactly.
So her reality was toothbrushing just wasn't going to work for her.
So it's getting to know the clients, your client, the pet owner, and the pet. And so the client may be gung-ho about brushing teeth, but if the pet doesn't tolerate it, then so you need to look at both.
Right.
Both avenues.
If toothbrushing really is the best, and if you look at the pet and you have a pet that doesn't even like to be handled around the mouth, what do you do?
Treats are the easiest thing. Probably the most compliance that we get is offering your pet a treat. And we have different, levels of dental chews. So we have a dental chew that's a beef rawhide. It's called our dual enzyme chew. And it has 2 enzymes that are impregnated on it. And those enzymes have a mild reaction when they meet saliva in the mouth. And they end up making or producing an enzyme that has antibacterial activity. So that's chewing. You get the mechanical action of the chew itself, as well as the antibacterial activity of this enzyme that is produced.
Great. How easy is that? And are these things pretty palatable and
very
pretty tasty?
Palatable.
Okay.
We have our step up from that is called a Hextra chew that has chlorhexidine, and chlorhexidine is the gold standard in both pet dental care and human dental care for its antibacterial activity. So that one, the Hextra chew, has chlorhexidine impregnated on it, as well as a palatant, a chicken-based palatant. So the dogs really, really like those. Those are very palatable. And the chlorhexidine sticks around for 24 hours just by nature of the way it adheres to the dental pellicle. It sticks around in the mouth, so you get an added benefit of 24 hours of activity, of antibacterial activity with that one.
That's great. That's wonderful. And so you can safely do these treats every day?
Absolutely. Absolutely. They're meant for once a day, but if you do them more often than that, my dogs get more than one a day just to make them mind for some things. You're not doing any damage or harm by giving more than one a day, but they're designed for once a day treatment at home. So that's probably the one that we get the best compliance with because it's easy. Brush your teeth in the morning, grab your bag, and give your dog a chew.
Perfect. So you can have your bag right there with your own toothbrush in the bathroom.
Right,
that sounds
exactly.
great.
Anything to create a habit.
Okay.
Creating habits is going to be the way that you're going to get better compliance and better regularity with your dental care at home.
Good. Okay, so treats obviously sound like a super way to go, a fun way to go to get your pet involved in enjoying dental care. What if you have a pet that needs a little more than what the treats are able to offer? So
then we move to our better to rinse category, and we have 2 rinses. One is a water additive. Very simple. You measure 2 teaspoons or 10 mils of water into of additive into every quart, and that's called Aquadent. So you dilute it out into their water bowl, and it's tasteless.
I was just going to ask, can they even taste it, or do you need to worry that they're going to avoid their water, can't taste a thing?
Rarely do we have anyone say that their animal won't drink the water. So it's just once a day, and if they finish the bowl, the rest of the day is going to be clear water. There's no need to add more to every bowl. So it's just once a day, and they drink that, and it has antibacterial, anti-plaque, anti-calculus activity in the mouth.
That's great. And what kind of product is it that actually does that? Is it another enzyme, or?
It's actually it's called Aquadent, the actual product is, and the active ingredient is xylitol. And xylitol has a kind of a buzz phrase. Everyone hears that, and they go, oh no, that's the one I hear about the killing pets. And what we see actually is that animals that have trouble with xylitol are the ones that go into their owner's purse and eat an entire pack of gum.
So this is a different thing. So you want to keep your pets away from gum and xylitol-containing products on the human side, but stick with Aquadent.
Aquadent is an animal-approved
product.
Yes, exactly.
Great.
So it works well, and at the required doses is perfectly safe.
Great. And then what about if you've got either a compliant pet or a super owner that really wants to offer best oral care at home and really wants to do the best for their pet in the way of brushing?
Right.
What would you suggest for people that are trying to get into a routine of regular brushing?
Regular brushing, most people get their toothbrush and want to go home immediately and start just running the toothbrush along the pet's mouth, and that's probably not the best way to go to get your animal to be compliant. What we usually recommend is starting with some toothpaste, squirting it on your finger and letting them taste it. It's flavored. Most of them, we have 5 different flavors. So letting them get the taste of the toothpaste, getting used to those. So do that for several days. And then what I would recommend doing, depending on the size of the animal, there are multiple sizes of toothbrushes. Taking your toothbrush, taking the toothpaste into the bristles, and then just holding the toothbrush down where the animal can chew on it. So they get the flavor and then they get used to bristles being in their mouth. And then you slowly, baby steps, work your way into actually getting the toothbrush in there, moving it around.
That's great. I like that thought. And then I always say it's great to just handle around the face, the mouth, get them accustomed to even having your fingers in the mouth and just handling there. And I think that does a lot of good.
Checking the teeth, so lifting the lip and looking at the gum line and at the teeth themselves on a regular basis is a good way to do it, starting from a puppy if you can.
Right.
Getting
I
them more
agree.
and more
Just
used
get
to
them
it.
very used to that. And there's so many things we can see by just looking into the mouth.
Absolutely.
You get a feel for what the normal color of the tongue and gums is. You see whether there's plaque and debris that needs something beyond home brushing and home care that your veterinarian needs to take care of. And really, any broken teeth, any discolored teeth, those are things that really need to be evaluated by a veterinarian, because those are things that are potentially painful conditions.
Absolutely.
And of course, what we're talking about here is so much more than cosmetics. It's really an important part of health, because any infection from in the mouth, any disease from in the mouth can go internally and really affect some of the other internal organs.
They can, and studies have shown that if you keep a clean mouth and you do your regular dental cleanings, whether at home or at the clinic as needed, that you can add up to 2 years to a pet's life, 2 healthy years.
And who
So it
wouldn't
makes a
want
big
to do
difference.
that?
Absolutely.
Healthy
It's
and
your buddy,
pain-free years. So
Right.
very good. Well, there you have it, and lots of helpful tips. So again, brushing is best, rinsing second best, good, and then third are the treats.
Chewing, yes,
and you can
absolutely.
really do all 3, can't you?
Absolutely, you can do all 3 without any harm or damage. So if you can't overdo it. The only thing you have to consider with the treats, if you give a lot, is calorie count. So,
there you go. Yes, you got to make up for that somewhere else,
Absolutely.
and that's another discussion. Well,
True.
very good, helpful information. And
Great.
again, by doing these things, we can help keep pets out of the dental chair there at the veterinary office. And so you really can do a lot to impact your pet's overall health.
Yes, you can.
Very
so much.
good. Well, Stacie, thank you so
You're
much for
welcome.
joining us
Thanks
today.
for having me. Yeah,
And
it's great
we'll be
to
back
talk
with
to you.
more next time.
Okay.
Well, it was great having Dr. Smith here, and as a reminder, all this month we are celebrating Pet Dental Health Month, so it's a great time to schedule a free dental examination or drop by for a free home dental health care kit. And right now, professional dental cleanings can be scheduled at a reduced rate. So call today at 214-342-3100. And if you have topics you'd like to see us cover right here on the podcast, you can call 972-808-6038. Or you can always email us at podcast@welovepets. And as always, don't forget to subscribe, and we'll be back with more same time, same place next week. Thanks so much.